Hey guys, we're looking at the hematologic system today, chapter 10 in your textbook. In regards to goals, if you look at your learning objectives, number 2, lymphosarcoma was covered by Dr. Adams when she talked about oncology, and infectious mononucleosis, which is also Epstein-Barr virus, we covered in chapter 5, infectious disease, when we talked about it, just so you know. Okay? So what is hematology? What are its components? And what two other body systems is the hematologic system integrated with? Hematology is the branch of science that studies the form and structure of blood and blood-forming tissues. Two components are, the first one is plasma and formed elements, which would be your erythrocytes and red blood cells, or your red blood cells. And the second is leukocytes or white blood cells and platelets. And platelets are also known as thrombocytes. Two other body systems that the hematologic system integrate with are the lymphatic and the immune system. Lymph nodes are part of the lymphatic system, but also the hematopoietic blood-forming system and the lymphoid system, which consists of organs and tissues of the immune system. Good night. Hematologic disorders alter the oxygen carrying capacity of the blood and the constituents, structure, consistency, and flow of blood. These changes can contribute to hypocoagulopathy and hypercoagulopathy, which causes an increased work of the heart and breathing, impaired tissue perfusion, and an increased risk of thrombosis. Signs and symptoms of a hematologic disorder are edema, infarction, thrombus, lymphedema, bleeding and bruising, shock, and lymphadenopathy. Lymphadenopathy is an abnormal enlargement of a lymph node. So why might someone have a blood transfusion? It's when the volume of blood within circulation system of the patient is less than that required to sustain life, or when red blood cells are deficient either in quantity or quality. Some indications for blood transfusions are anemia, major surgical operation where someone lost a lot of blood, accidents resulting in considerable blood loss, cancer patients requiring therapy, women in childbirth and newborn babies in certain cases, patients of hereditary disorders like hemophilia and thalassemia, and severe burn victims. You can have disorders of erythrocytes from a hematological standpoint. One type of disorder is anemia. The definition of anemia is a reduction in the oxygen carrying capacity of the blood from an abnormality in the quantity or quality of erythrocytes. Anemia is not a disease, but a symptom of many other disorders. Anemia causes commonly seen in PT fall under 5 broad disease-related categories. Number 1, it could be iron deficiency associated with chronic GI blood loss secondary to NSAID use. Chronic disease or inflammatory diseases such as rheumatoid arthritis or systemic lupus erythematosus. The third commonly cause of anemia seen by physical therapy are nutritional conditions. That is malabsorption syndrome leading to vitamin B12, folate or iron deficiencies, or alcohol abuse leading to folate deficiencies. The fourth common cause is infectious disease such as tuberculosis or AIDS. And the fifth most commonly seen category from anemia, cause of anemia, is a neoplastic disease from a bone marrow failure. The etiology of anemia is excessive blood loss. You have increased destruction of erythrocytes and decreased production of erythrocytes. And I did not spell increased correct. I see that there. Let's see if we can fix that. Okay, obviously I'm afraid to fix it because I'll lose things, so I'll fix it before I post it for you. If you look on page 326, box 10.3, you have common causes of anemia: excessive blood loss, destruction of erythrocytes, and decreased production of erythrocytes, and some causes for that. You just want to take a look at that and have an idea We see patients with these multiple diagnoses all the time as therapists. Signs and symptoms of anemia are weakness, dyspnea on exertion, fatigue, pallor, and tachycardia. Those are some common signs. You also can see the fingernail here. It's the spoon-shaped nails that may be idiopathic, congenital, hereditary, or due to iron deficiency anemia. You can tell a lot about someone's system in regards to their fingers and nail beds. There's also in your book talks about disorders of leukocytes up underneath hematological systems. We're not really going to talk about these. I just left this in here so you could see that we do have disorders of leukocytes that occur, but we don't really treat. We have patients who have leukocyte disorders, and they might present as any one of these. Neoplastic diseases of the blood and lymph systems include leukemia and malignant lymphomas. Leukemia, it can be acute leukemia or chronic leukemia, and lymphomas can be Hodgkin's lymphoma, non-Hodgkin's lymphoma, or multiple myeloma. And all of these are types of neoplastic diseases of the blood and lymph systems. For these types of pathologies, a bone marrow transplant is the treatment of choice. Leukemia is a malignant neoplasm of the blood forming cells that replaces the normal bone marrow with a malignant clone. It's a genetically identical cell of lymphocytic or myelogenesis cells. The disease may be acute or chronic based on its natural course. Acute leukemias have a very rapid clinical course resulting in death in a few months without treatment, whereas chronic leukemias have a more prolonged course. There are 4 major types of leukemia, and they are acute and chronic lymphocytic and acute and chronic myeloid leukemia. When leukemia is classified according to its morphology, it's by the predominant cell type and the level of maturity. The following descriptors are used. Lympho is used for leukemias involving the lymphoid and lymphatic systems. Myelo is for leukemias of myeloid or bone marrow origin involving hematopoietic stem cells. Blastic is for leukemia involving large, immature, functionless cells. And cytic is for leukemia involving mature, smaller cells. If classified immunologically, T-cell and natural killer cell and B-cell leukemias are described. Your book has that, guys. Has everything I just said to you, okay? Symptoms of leukemia are anemia, infection, and bleeding tendencies. 3 main symptoms occur as a consequence of this infiltration and replacement processes. The anemia that we see is you have reduced tissue oxygenation with decreased erythrocytes. An infection from neutropenia as leukemic cells are functionally unable to defend the body against pathogens. And we have bleeding tendencies from decreased platelet production. Malignant lymphomas are general term for cancers that develop in the lymphatic system. There's 2 groups: Hodgkin's lymphoma, which is also known as Hodgkin's disease, and non-Hodgkin's lymphoma. In recent years, it's become more useful to categorize lymphomas according to their clinical behavior, which is whether it's indolent or aggressive, and their chromosomal features. Current Hodgkin's lymphoma is distinguished from other lymphomas by the presence of a characteristic type of cell known as the Reed-Sternberg cell. All other types of lymphoma are called non-Hodgkin's lymphoma. If you look at this, this is just a schematic from your book in regards to symptoms. This is just the pathological basis for clinical manifestations of leukemia. And I'll let you guys take a look at that. So leukemia can wreak havoc on someone's system tremendously. Multiple myeloma is the next pathology. It's a primary malignant neoplasm of plasma cells arising in the bone marrow. Its incidence has doubled in the past 2 decades, with an annual incidence of approximately 16,570 cases in the U.S. Clinically, it's a gradual and insidious onset. And common presenting features include fatigue, bone pain, and recurrent infections. Remember from what you have learned in your exercise course with Dr. Adams, anything that creates bone pain is a red flag for cancer. So you want to pay attention to when someone tells you that their bones ache and what that pain is. Does it wake them up at night? That can be a big telltale sign that something else is going on systemically. We have disorders of homeostasis. There they are. Out of these, we're going to talk about hemophilia. We're going to talk about sickle cell disease and sickle cell disease, okay? Hemophilia, what is it? What are the 2 primary types? And it's characterized by excessive bleeding, right? Hemophilia is the bleeding disorder inherited as a sex-linked autosomal recessive trait. There's 2 types, hemophilia A, which is classic hemophilia, and hemophilia B, or Christmas disease. Hemophilia A results from a lack of clotting factor 8 and constitutes 80% of all cases of hemophilia. Hemophilia B is less common and it affects approximately 15% of all people, and is caused by a deficiency of factor 9. You can also have other less common deficiencies, such as deficiencies of clotting factors 1, 2, 5, 7, 10, and 8. But these are rare and not fully discussed in what you guys have read. The gene responsible for codes for factors 8 and 9 are located on the X chromosome, making hemophilia a gender-linked recessive disorder. Because females normally carry 2 X chromosomes, they only develop hemophilia if both genes are affected. If the normal gene is inactivated, or if they only have 1 X chromosome, so therefore hemophilia is rare in females. Males, on the other hand, only inherit 1 X chromosome and therefore develop hemophilia because they lack another normal X chromosome to provide the clotting factors that are needed. So females are the carriers of the abnormality, and males present with the disease in regards to hemophilia. Signs and symptoms of hemophilia, you can read those there. This is signs and symptoms of hemophilia bleeding episodes. So if someone has bleeding into a muscle or into a joint, the symptoms on the right will manifest, okay? HIV and hemophilia. 50% of people with hemophilia before 1986 became infected with HIV because we didn't screen blood very well. Since then, I don't think there's been any known cases. I think that's what your book talked about. Sickle cell anemia. What is it? What's the pathogenesis of sickle cell anemia? Sickle cell disease is an autosomal recessive disorder characterized by the presence of an abnormal form of hemoglobin within the erythrocytes. This irregular form of hemoglobin is the result of a single mutation in the beta hemoglobin chain where the amino acid glutamic acid at position 6 is substituted with valine. In normal hemoglobin, the amino acid in the 6th position is glutamic acid. In people with sickle cell disease, the 6th position is occupied by another amino acid called valine. The single point mutation of valine for Glutamic acid results in the loss of 2 negative charges that causes surface abnormalities. The sickle hemoglobin transport oxygen normally, but after releasing oxygen, hemoglobin molecules that contain the beta globin chain defects stick to one another instead of remaining separate and polymerized, forming long, rigid roads or tubules inside red blood cells. This chain, these rods cause the normally smooth donut-shaped red blood cells to take on a sickle or curved shape and to lose their viability to deform and squeeze through tiny blood vessels. The sickling is reversible for a time because the cells are reoxygenated in the lungs, but eventually the change becomes irreversible. The erythrocyte membrane becomes damaged in the process of sickling and unsickling, and the cells are removed. The sickle cells become stiff and sticky, and they clog up small blood vessels, depriving tissue from receiving an adequate blood supply. Tissues experience increased oxygen requirements under stress, causing more hemoglobin to release its oxygen, which leads to increased numbers of deoxygenated and polymerized cells. When these cells stick together and clog the blood vessels, occlusion of the microcirculation increases and you develop hypoxia. And you develop tissue injury. The organs at greatest risk are those with sluggish circulation or low pH and high level of oxygen extraction. That would be the spleen and bone marrow. Or those with limited terminal arterial supply, which would be the eyes, the head, and the head of the femur. There is no tissue or organ in the body that is spared injury. The higher the concentration of deoxygenated cells, the more severe the complications. All right, that's it. Ignore that last picture, okay?